I want to thank the Roundtable for the invitation and the opportunity to talk about our work at Vanderbilt. Of course, our strategy is different from the approach of BINGE, which is more starting with the mission. Not that our mission doesn't reflect what we're doing, but our approach really has been thinking about more what structure will we need to facilitate an approach or approaches towards health equity. So we started with, as part of actually our AAMC project, thinking about what we're doing already that's related to community health and health equity. To our surprise, a couple of years ago, when we started to look internally at what we're doing, we identified more than 180 initiatives and programs that are focused on community health and health equity. Now, these actually range broadly from research projects to health education in the community, but also some community engagement work. So we were fortunate enough to bring together really leaders from across the institution, and so some of the pictures are there. So we have the leaders in population health, diversity and inclusion, the academic medical enterprise from the standpoint of the student education, research, and bringing everyone together, nursing as well, to really think about what we're doing is how we got to this really large number. But what we found is what many other academic medical centers find is that much of that is siloed and disconnected. And I personally have had a leading role in our community engaged research work and really mostly knew about the work there that we were doing locally and around the country. What we've found from those interactions with the community has already been reflected in the discussions today is that we continue to think about how we can have these opportunities in the community without really bringing back their voices to the table and having that reflected in the design of the programs and the activities. And of course, we still, despite our efforts, continue to do more helicopter or drive-by work with the communities instead of really investing in them. So what we've decided to do at Vanderbilt is actually take an enterprise-wide approach to how we'll address health disparities and advance health equity. So just earlier this year, we have launched a new Office of Health Equity, and that is intended to be, again, enterprise-wide, bringing in the efforts from education and training, research, community and population health, all together under one umbrella. And really, it's critical to be sure that there's an institutional investment, and I'll say a couple of things about that later. I, as Philip already announced, am the vice president in that role, and Eliza Friedman is joining me as the assistant vice president. She's been leading our community health needs assessment for the last 2 cycles, so bringing that in as well. So what are we doing around education and training? The idea is that if we're really going to have an impact on health equity, we can't just continue to think that this lives in the margins at the community. We have to better train and educate health professionals, and we also have to make sure that everyone realizes that they have an opportunity as well as a responsibility to have expertise in health equity. So the idea that health equity really transcends specialties and bringing in people who are surgeons and subspecialists in different areas and having them recognize that there's a role. And we have many great role models that are doing this around the country. In our research enterprise, we spend so much of our time in these large academic health centers focused on research, but what could we be doing better to actually understand some of the social determinants of health and social risks and how they could be applied or addressed? The beautiful young ladies here are twins, but externally, if they're walking separately, we might categorize them as having different races. And what can we better understand about the intersection between race as a social construct and genetics? And we're starting to do some of that with our large biobank. As our first community, we're actually focusing inward and thinking about how we can address the needs of the more than now 24,000 Vanderbilt Medical Center employees who have varying needs, priorities, social risks, as well as incomes. And so thinking about where they live now and affordable housing in the very rapidly growing Nashville, and having them help design wellness programs and determine what kinds of assets they need to be healthy. And we're really glad that when we talk to our colleagues at Rush that they're focusing internally, or have been as well, for their programs. So what are we doing really at the institutional level? So there is a strong executive level commitment. Fortunately, with the budget, we have secured funds to launch this, and I'm not sure they know how much money I'm going to ask for in the future, but we'll get to that later. We are developing a health equity metric that is going to be part of the performance goals and an incentive plan for the executives. And again, really making sure that we're supporting the work across the different mission areas, not saying that we have to do it all because we shouldn't and we don't want to, but we want to support it, track it, and make sure that there are metrics in place to assess it. Thank you.